Hello everyone, I am Sara EL-ATEIF, a Google developer expert in machine learning and Google PhD fellow. I'm pursuing my PhD at NCS. It's a Moroccan school, part of the Mohammed V University. And today I will talk about AI for healthcare. So let's get started. So today I will be quite briefly introducing what AI is. I will talk about global health challenges that we're facing right now in this era. Then AI health use cases, top 5 ones, reward examples, and then I will showcase the technical and ethical challenges that we're facing as well. I mean, AI is facing in the healthcare field, and then we will conclude. So, first things first, what is artificial intelligence? So, practically, our artificial intelligence is actually, if you can think of it, like a set of tools and techniques which aim is actually to replicate how we human think and act. So that's like the big goal of artificial intelligence. Now, artificial intelligence is like the big field, and like previously what we did, we used like very basic algorithms to try and replicate humans thinking and actions. But in this era, like we have seen several developments in this field which gave birth to machine learning and then deep learning. So machine learning is a subset of artificial intelligence, which main aim is to improve the algorithms that we had previously in AI in such a way that we give it the data and it can learn through this data to perform specific tasks. Meanwhile, for deep learning, actually, deep learning was inspired from how we humans think. So, we humans have what we call neurons in our brain that light up and then, like, transmit data they transmit synapses, or like you can think of them as electrical signals from one neuron to another. So, that's kind of how we develop a deep learning to be. So the aim from it is like for us to give it data, and then from the data that we will give it, for it to learn from it, and then without having us the humans introduced into the pipeline. So what is the difference between deep learning and machine learning? So apart from the complexity of the algorithms used and their depth, there is also the fact that in deep learning, the only thing we actually do as humans is feed it the data. Meanwhile, in machine learning, we need to like tell the algorithms exactly what kind of features we want it to look at and you know, keep attention to when it's during its learning process. Meanwhile, for deep learning, it's supposed to start from scratch and try to figure it out by its own self. So, what are these global health challenges that pushed us to, kind of think and introduce AI into the healthcare system? So, the first one and the first stressing was is actually the fact that we have health worker shortage. So, practically, so BBC found that we have only 50%, like 50% of the countries have less than one doctor for 1,000 people. And I'm not sure like about your country, for example, but for Morocco, we still have like in specific places like rural areas, some people still can't have access to different specialists, like doctors specialize in specific diseases. So at best what they can have is like a generalist, like a doctor that kind of knows everything but isn't specialized in some kind of disease. And so if they really want like to kind of figure out if they have some kind of advanced disease, or like for example they have issues in their eyes or in their lungs, they need to go to specialists which are only available in urban areas. And then for example for advanced diseases like cancer, we actually do have only few specialists. And this is not only true for health, workers, for doctors, but actually for machines and tools used during the diagnostic process, prognostic, and any kind of like pipeline in the healthcare system. We do have a shortage of them. Like for example, MRIs, we don't have much. Like we might have like around 1 to 4 MRIs in all of America. So apart from that, we have something called emerging threats. So things like COVID-19. So for example, in this era, we have 90% premature deaths due to this, to, for example, COVID-19, the unforeseen pandemic. Then there are things like climate change, like lack of rain these days. And as I'm not sure if you know this or not, but rain actually helps get rid of a lot of diseases that pollutes the air. There's also pollution and antimicrobial resistance that makes it even more difficult to treat. So, apart from that, we have what we call non communicable diseases that now cause 70% of deaths. So, what we mean by non communicable diseases are diseases that, they are like something not like COVID-19. So, for COVID-19, it is actually communicable, so it can be transmitted from one human to another. But for example, diabetes is not transmittable. Like if you have diabetes, you can't really transmit it to someone else. So most of the deaths, right, like in especially like in the last 10 years, actually due to either cancer or diabetes or some kind of very well known diseases. So apart from that, there are also infectious diseases that are still out there, like malaria, for example. So apart from that, as I told you before, we have some populations that don't have access to health, healthcare professionals, and those are what we call underserved populations, and we have like more than 734 million people that access to essential health services, and that's a huge number. Well, apart from that, in like by 2050, mostly everyone is going to move from rural areas to urban areas, and that means that we will be increasing our exposure. Humans will be increasing their exposure to unhealthy lifestyles, and that means, and we will be changing. Like it's like as right now, we eat unhealthy food when we don't find our moms to cook for us, and stuff like that. So all of these actually increases our our, I can call it chances, but obviously it's a bad thing for us. So it increases the chances of us getting sick. Now, apart from that, obviously, when we have more patients, we have a higher demand in the market for healthcare providers, right? So that means we have more patients, and that means the market of healthcare is going to increase, of course, in revenue and in demand. When we have lots of demand and we will be having very low offer, which means we will be having low healthcare providers and then higher number of patients, which is actually like so in 2020 it was around 10 USD trillions, and it's like, well, it's supposed to double now from 20 years from now to become like 20 USD trillion. That's like the value of the market of healthcare. So these are the reasons why we need artificial intelligence. Remember, the main purpose of artificial intelligence is to, automate the process, right? Automate all processes and then replicate how we humans do things. So if we have more fake, more AI doing, what we humans do in the healthcare sector, it will be able to, make the process go faster, and then obviously you'll be able to help more people than we humans right now can do. So what are these AI use cases, like where can we apply AI in the healthcare system. So first things first, there is what we call population health. So what do we mean kind of population health? So I'm not sure if you knew about this or not, but actually way before COVID-19 kind of broke through and then became a huge pandemic, there were some actual companies and some like some some organizations that already knew that COVID-19 was happening. So usually these companies were obviously aware of it through social media and through them analyzing several logs happening. So this kind of monitoring of social media or monitoring of the transactions, the conversations we human make, kind of can help us prevent huge outbreaks of some kind of diseases that may even be unknown to us. So, for example, if one person is affected and we know about it early on, we can prevent, its spread as early as possible. And usually, like that is the key matter in this kind of, the kind of pandemics or other diseases that are transmittable. So, how can AI help us? Obviously, by analyzing our conversations, social media, how we interact with people, what is happening in the industrial chain, and other matters like, of course, what is happening in the climate and all of that as well. So, apart from that, we can, like include it in the preclinical research and clinical trials. So, this is like headed towards like drug discovery and design and some personalized therapy and trial design and execution. So what do we mean by this? So if I'm not sure if you heard about this or not, but in there are some people who some treatments do not actually help at all. So, for example, if let's say if a kind of medicaments actually works for you, that might not be true for other people from your family, for example, and that is because they have some kind of antibodies that kind of make it difficult for that medication to to kind of take effect. So these kind of people need what we call personalized medicine, and this is especially true for people who like who have some kind of types of cancer, not just diseases, but this is like really critical for cancer, because there are some people who like they go through chemotherapy and like they give them some kind of meds, but it doesn't work out for them, like it doesn't help them fight the cancer that they have in comparison with other people that in the clinical trials actually worked out for them. So if we can figure out like how the disease is kind of what it is made of for their specific DNA, for the specific genes, we can actually come up with a specific drug just for them. And this is like all of us are kind of different, like even though we're all humans, we do not share the same genetic sequences, kind of. So some kind of things like need what we call targeted therapy, which means things that will work out specifically for you. So now let's talk about clinical care pathways, what they call integrating into new and existing clinical workflows. So actually, in these days, we do have AI actually included in our healthcare systems, although we cannot see it and it's not touchable yet. So you can see it in actually like huge scans. So for example, things like MRIs from Genentech or Siemens or any kind of other, manufacturer of this kind of huge scanners. So they do include AI, so they can kind of like accelerate the process of rendering these kind of images that go from these scans. So for example, where if you're going to build a CT or a specific MRI, instead of taking, for example, 1 hour to render a specific image of a certain patient, you can take, like, for example, less than that, let's say 30 minutes to do that. So this is like one of the examples where you can find AI included inside the healthcare system. So there's also patient-specific solutions, facing solutions. So, for example, interacting directly with patients, providing non-clinical therapies, information, and advice. And I'm sure, like, this kind of example, you have heard of them and even see them perhaps in, like, what we call chatbots. So where you can have a conversation with a chatbot. It tries to understand your symptoms and, try to give you advice or tell you what you have. But obviously, these are still not, like, 1000% approved clinically. So, for example, even though they kind of give you some kind of advices and what you may have, they still tell you to check out with the doctors. So in the future we may have, like, more foolproof chatbots. So apart from that, there's something called optimization of health operations, which is like optimizing backend processes in healthcare. So in this, actually, it can be like, for example, storing data from the scanners. Like, usually in the healthcare, like, system, they have what they call the packs. So it's like it's kind of like a database that we developers have, where they store their own data. So perhaps we can optimize, like, the access to these scanners, or perhaps we can optimize, other processes that usually take a long time, like storing data, consulting, EHR information, patient specific data, and all of that. Now let's check out some real awesome word examples. So we have this, like, amazing tool called HealthFlow. It's actually a non-invasive diagnostic test that helps physicians identify the impact that blockages have on blood flow to the heart. So practically, it's just that, like, people who have what we call heart diseases, they sometimes have blockages in the tubes that you see. So some of them may actually be, like, very thin, or like they have something stuck in it that can't let the blood flow, and that can kind of, cause heart attacks along the way if they aren't detected earlier and, changed, or, kind of unplugged. So, what does this heart flow, this new invention, provide to the health, to the doctors and to the patients? So, what it does is that, so normally in a typical workflow, they will be using, like, a very difficult to acquire and invasive kind of scanner to get like the pictures of what is happening in your heart, and it will take a long time and a lot of series of tests to figure out what is happening, you know inside that heart of yours. So what they did through the solution is that they used a less expensive and more accessible scanner, which is the CT, computed tomography. And through this computed tomography, they actually tried to, extract information, kind of like simulate of what is happening, like you see in the on the picture, like black with a kind of a heart in blue, and then some kind of branches. So that's like what is that's like the schema extracted, the 3D schema extracted from the CT scan. So through that, what they try to do is that they try to figure out, like, to design the paths where the blood is going to go, and if there are any issues, so you can see them in this 3D schema. So sometimes when these kind of scans are done, sometimes you may have some kind of information that are lost because, like, you can't see them well in the scan. So one of the good things that this heart flow actually does is that if you kind of have some missing information from the scan, it can actually fill the gap by providing what they call functional information. It's like kind of more details about what is happening inside those steps and all of that. So it also provides the highest diagnostic performance. So according to them, because CTs are more, like more accurate. They provide like um, higher true positives and lower false positives. So it can provide them like more accurate information about what is happening inside your heart, instead, like in comparison with like the tool they are typically using to kind of diagnose this kind of problems. That's why it has a highest diagnostic performance. Also, it has a long-term outcomes like up to 5 years, in contrast with the previous, like with the old way they were doing things. Also, it's a non-invasive test, which means they won't need to do lots of invasive tests, inculcating some kind of drugs and all of that to check out what is happening. And then obviously it reduces the costs. Why? Because we'll be having less tests. You won't have to go through 10 MRIs or something like that before you get to the end of what is happening inside your heart. And then obviously that will obviously reduce the waiting time. Now let's check out the typical solutions I was talking about. So from Buoy Health. So it's actually an AI-driven online symptom checker and HRIS solution. So what it does is that like you kind of it's like a chatbot. It kind of like lays out some questions for you, and then through your answers you will be providing from these questions, we actually are like just check boxes. They kind of try to figure out what kind of disease or what kind of thing you're having, and then they obviously like provide some advices or some references to doctors you can check out and you can talk with. As long as what is really cool about them is that if you have some kind of type of insurance, they tell you if your insurance cover it or not. So at first what they do is that like they listen and help you make sense of the symptoms you have. Then obviously if they kind of try to figure out if it's if you can just take some kind of thing quickly, or like if it's something that really needs a doc that needs you to see a doctor. And if you need to see a doctor, like I told you, they provide you some kind of advices, and then like some people you can refer to. And then obviously if you have coverage, you know insurance, they can see if it's covered by it or not. And obviously if there's any kind of tip of trick for you to make it covered. So there is another really cool app from Google that is called Dermacyst. So it's a guided skin search application that helps you find personalized information about your skin concerns after a few questions and like 3 quick photos. So you just need 3 photos. You take 3 photos of your skin, hair, or nail conditions, and it will help you identify what kind of problem you have. So it can identify 288 skin, hair, and nail conditions, and it can give you like results within just a couple of minutes. And what it does is that it provides you with a list of possible matching conditions with information about each condition. So as you can see in this picture, they, for example, say that the person has melanocytic nevus, also called mole, and like they determine what kind of symptoms it might, kind of have, and then like they tell if it's contagious or not, the severity, the treatment that is possible, duration, how much it can last, and then how common it is. So now let's talk about technical and ethical challenges. So, you know, when developing AI algorithms or AI solutions, um, the people, which are us, when we the machine learning people try to develop these kind of tools, we usually only think about performance of the models. If we're very good at what we're doing, we will be like worrying about the type of data that our models are going to digest and try to learn from, and then like we can at most question some kind of you know inferences, and then check out the like what the model looks at, which we call explainable AI. So apart from these things in healthcare, there are a lot of things we need to account for. Actually, in real life, there are a lot of things we need to account for if we're going to be deploying AI, and that is going to be used by other humans. So some of these things are like transparency and explainability. So we need to understand. So one of the things actually that doctors really, really search for when you will be providing them these solutions is, do they explain what your model, you know, kind of was based on when making a certain decision? So if it's predicted that someone, for example, has cancer or not, can your model explain why it thinks this person has this type of cancer or has actual cancer through some kind of data? Like it's like for a doctor, for you, like when they're approaching you and they tell you you have X or Y, they actually know that through symptoms, because you're having, for example, fever, you're suffering from this and suffering from that, and you have been exposed to this and that. This is what helped you, kind of get that kind of disease. So this is what is extremely important for them. This is one of the criterias that they actually base on to think about using your model or not. There's something else that is called accountability. So what do we exactly mean by accountability? So it just very simply means who's going to be accountable if something happens. So, like, who are we going to blame or sue if your model makes a mistake? That is very important, and actually, like till now, we still haven't figured it out yet. So there's still lots of research going on that point. Apart from that, there's actually what we call ethical data use. So when we go around collecting data, did you have the consent of your patients, or the people you collected the data from? What kind of data did you use? From what population did you pick it? you know there are lots of things related just about the data. Now let's talk about regulations. So this kind of algorithm of yours, does it infringe any law that we have? And like, what kind of people does it serve? Is it has it been tested? Uh, Stuff like that. Now, another thing we worry about is privacy and security. So is there any leakage in your model? Like, for example, if can someone back engineer it and figure out who has disease X or disease Y? Is the data that has been provided for you to train your models on, is it like secure, like stored in a secure way? Like, do people like, is there no leakage that is going to happen? Isn't going to be spread or something like that? There are things like data limitations. That means, if you want to collect data, especially healthcare data, you need a huge storage, right? And to process this, you need lots of computing. So these kind of things are not available in all the hospitals. I'm not sure if you had the chance to see the hospitals in some kind of very um uh like non-urbanized areas, or even actually in some urbanized areas, you might see some hospitals that lacks just the basic kind of tools needed. So yeah, it's already very difficult just to get the basic tools needed to actually diagnose and treat patients in a normal setting. Can we really afford AI to be added? Because if you add AI, obviously you will have to digitalize most of the processes, or at least the process you want to automate. That would mean you would need cloud computing, you will need high, like HPCs, and then you will need, obviously, that is for storage, and then you will need an internet secure kind of, network. and just like that. Now, apart from this, there is a real huge problem going out there about bias. So, what do we mean by bias? So, actually, bias is very simple. So, my skin color is kind of yellow, right? And then there are some people who have skin color that is black, and there are some people that are white. So we have lots of different tones, right? And then we come from different ethnic groups. Some are Arabs, some are Asian, and like each one of just these huge subgroups, they have very specific genetics, and we have very specific features. And so what works for you may not work for other people. And so this kind of problem actually happens. So if your data is not as diverse as it can be, your model isn't going to work out for everyone. So we need to know exactly who your model is working for, and when does it fail, and when does it succeed, when does it fail, and why is that so. That actually like goes back to the transparency and explainability kind of thing. Now, clinical utility. Like these days we all like this kind of new shiny thing called AI, and we go around trying to be superheroes and then classify breast images as cancer or not, using mammograms, and trying to figure out if someone has a brain disease or not using MRIs. But does whatever you developed really help your perhaps your hospital, or like the nearest hospital in your neighborhood? So you need to figure out what your society, what your hospital, what your healthcare system really needs, and prioritize that. And then obviously you can use AI to help them revolutionize that process, what they need. So it's very important that it's something that is relevant clinically, and not some kind of shiny tool that is going to be developed but then not used by the healthcare providers. So in conclusion, AI has lots of opportunities in healthcare, and it faces a lot of challenges. So as we said, for opportunities, we have a huge market, obviously, because we will be lacking lots of doctors in the future. We will be having lots of patients. And then what is really cool is that these kind of intelligent algorithms are in constant development, as well as computing resources. So we're trying to find ways to deploy this kind of huge models into like digitalized systems that can handle them, and like serve them quickly, so that we can get a response way quicker than we usually did before. But there are always challenges to these kind of things. So there are implementation challenges, accountability challenges, fairness challenges, and even like sometimes there will be human, just normal, typical human kind of challenges where, for example, doctors, they kind of will feel insecure using your AI system. Not just about doubt, but more like they will be very hard to convince, like to make that kind of change and include that thing inside your system. But the thing about life is that there are always challenges when you come up with something new, like anything. Just what happened. Look at what happened during COVID. So before COVID, everything, like, well, mostly, I mean, like the most part of the world was like we were studying face to face, and we were still using books, we were still using materials that can be touchable. But these days, look at what happened. Like most of us are using Zoom to have meetings, or check out online events, attend them, and then learn and like writing using notes using our laptops. So things change. With change, obviously there come challenges that we need to face. But we as humans, we need to turn these challenges into opportunities. It's because at the end of this day, actually challenges are just new opportunities. So I'm sure if you have heard that AI will replace humans, right? So I mean, AI will be replacing humans in some jobs that, frankly speaking, we humans should stop doing because they have become kind of like of a routine, and it's like an insult to our superhuman, you know, super awesome brain cells that we need to use for things that are more towards things that are, develop thinking and kind of come up new challenging and creative way of doing things. So we need to use our intellect to solve problems that not even computers can actually solve. And those usually relate to us humans, indeed. That is why actually, technology is normally, and like the first time it was developed, it was at the service of humanity. But it can only be so if we make it. So if we make this technology into our service, develop it so that it can help us humans, then it will be so. And that means we will have to develop ways and obviously come up with new algorithms that will help overcome things like accountability, fairness issues, bias issues. So we need to come up with new ways to make AI into our service. So, make it help us revolutionize how we do healthcare. Make it make it so we can make healthcare accessible by anyone and everyone. And make it help us reduce health costs. It's because right now healthcare is really expensive and it's not affordable by everyone. That's why we have a very high number of deaths. That's why we have some kind of deformations, and we have we lose a lot of 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 human life just because some people can't get access to healthcare, or sometimes they don't even know they have some kind of diseases, which normally in some countries, because they know it affects a certain um, um, population, they kind of do get checked, every for example every 3 years or so. Some other peoples in other countries don't get this kind of treatment, and they don't even know that they can be affected by some kind of diseases simply because they don't have access to healthcare. That is why I say it again and again. Technology is at the service of humanity if we make it so. So if we can overcome the challenges that we have and develop AI tools that can help us overcome all the challenges, apart from the ones that relate to humans, we can do a lot of amazing things and save a lot of lives and improve all of our lifestyle, and obviously avoid things like cancer. Thank you very much for your attention. I look forward to your questions, and I hope you enjoyed the talk. So do you guys have any questions for me? If you don't have questions for me, I have a question for you. So I'm curious, if tomorrow they told you that, the doctor that is going to treat you is actually an AI system, will that make you feel uncomfortable, or will that, will that not matter to you at all? I'm quite curious to know what people have to say. Oh, so I would like to ask you about the ability to use AI to detect heart diseases. Give us an example. So if you check it out, like the example from Heart Flow, that is actually something they are using to improve how they treat heart diseases. So usually heart diseases, well, they come from from several factors, but the most important one usually is like that we kind of strain our heart. So because like we do some kind of activities, or sometimes we don't do any kind of activities. So for example, if you get angry, or there is something really huge that happens in your life, it can kind of, like you get stressed, and then like the blood is going to flow way more than your heart can handle. And because of that, our heart fails. And usually it's actually just due to the tubes that actually can drive blood to your heart. So if they get stuck, or something happens in between, or they get thin because of like some kind of issues that happens, it can actually cause what we call a heart attack. And so what they did, this heart flow solution, what they did is that they used like a cheaper modality that is called CT, computed tomography, and they try to infer like how usually like the shape of the heart, and like what happens in these tubes that are usually like responsible of like transmitting blood to your other vessels and to the other parts of your body. So what you see in that city, they try to modelize it into another 3D. And then through that, the doctors can see where the problem is, and they can try to come up with a way, like they try obviously different combinations to figure out how they can fix those small tubs. So if they can unplug them, they will obviously do a very small operations to unplug them. But if like it needs another operation, or like for a valve reparation or some other kind of things, they can figure them out earlier. But sometimes in like if you use the typical modalities that are used to figure out what is happening with the with our heart, they can't see those kind of problems early on. And if they can detect them, they can save what is like what can be fixed earlier cannot be saved, because they can't see it early even if you come do a checkup. So this kind of solution helps them spot problems earlier, and helps you avoid having heart attack and dying obviously. How can we develop ourselves in healthcare career? Are you talking like about AI? Well, mm, AI for healthcare. If it's for AI for healthcare, so obviously if you want to develop yourself, you will have to become better at machine learning, like become really good at it obviously, and learn about like what happens in the domain, which is healthcare. So if you're, for example, interested in public health, you will have to go learn about public health and how you can use AI to help in that domain. And obviously, you will have to do, projects in that direction, interact with doctors, and try to learn as much as you can, like diploma or other else. So yeah, you can definitely check out if it's possible in your country, or in you can of course do it abroad. There are actually what we call cross diplomas, where you can learn about AI and healthcare at the same time. So it's like you will be having a kind of you know double kind of expertise, which is actually what is really required these days, to like not only be good at AI, but also to be good at the domain where you're going to be, applying this AI to. Also, one thing I wanted to add is that thank you, Dal. So one thing that I wanted to add is that as you have seen through this presentation, there isn't only one thing in healthcare that you can focus on, you know? So don't go around only focusing on deep learning and trying to do classification, segmentation, and all of that. There are other really interesting areas you can focus on. So, for example, there are health regulations, there are things like how you can fight bias, there are other things like, you know, how can we actually, provide the right platform for these kind of AI algorithms to run on. How can we perhaps leverage low resources to so we can deploy them in our, in low and middle income countries. So try to focus on things that are, the closest to the kind of problems you're facing in your community. So if your country is like facing issues, for example, in public health, so for example, or there are diseases like that are transmittable, like for example, you have lots of malaria, you have some kind of disease that you see a lot of in your country. Try to focus on that and see how we can use AI, how you can use AI to help your healthcare system. Is there a DL model that I can use it to detect heart disease? So usually in healthcare research for what we call cardiography, sorry, I mean cardiology. Um, so mostly what they do is like they try to understand how the blood flows through the tubes that I showed you. So the heart flow solution, I do highly recommend you check out their research papers. They had to write around 500 research papers for them to validate this model. And all the research I have been seeing in cardiology for AI actually try to just figure out how the blood pumps and what happens in the heart exactly to of course solve the problems that they have. AI scope, how code and basics. I mean the roadmap. So mm, if you want to dive deep into artificial intelligence and applying to this kind of new domains, what you need to do is to master AI. Obviously, you will need to master machine learning and deep learning algorithms. So that will mean things like you will have to be good at mathematics. So usually in maths, you have what we call linear algebra. So you need to really improve your linear algebra. That means how you deal with matrices, how you can, deal with tensors, how you can kind of transform, take different kinds of types of data. Especially in healthcare, we have 3D images, or we have tabular data, or we have time series data. So you need to be really good at reading different formats, because like most of the scans, like for example MRI or CT scans, they are like stored into DICOM format. So that is a very different format. So the thing is, you need to be very good at things that can help you get data and read it. That means matrices and tensors. So you need to be very good at maths. And then, as you know, like most of the algorithms are actually based on probability and then inferential statistics. So you need to be better at what we call inferential statistics and probability. So that just typically means advanced probability and statistics. And then you need to be really good at some kind of framework. You don't need like to be expert in it, but you need to know the basics: how you can read the data, how you can train your model, and how you can visualize what is happening in those models. And obviously, you will need to be very good at translating what you're doing to human language or what we call layman terms, so you can explain them to normal people. So you will need to learn how to do storytelling. using data. So these are like the huge, the highlighted roadmap. There is one thing that we usually forget about, and that is deploying these models into real world. And that means you have to figure out how to use cloud computing resources and how you can access them, obviously how you can deploy models. And that means you will have to learn about APIs, microservices, or practically MLOps. Can computer vision models be more accurate than humans in disease diagnosis? According to research, there are lots of models that have been developed that are way better than humans at spotting diseases. But the thing I can tell you about this is that AI is only as good as its data. So if you have garbage in, obviously it's going to be garbage out. So if, for example, the doctors you have hired to annotate your data are really good at what they're doing, they're very good experts at spotting disease X or disease Y, and then obviously your data is at a high quality, and you develop the right model, obviously you will have a model that is way better than other humans, simply because you took the best of the best, leveraged it, and provided it as a service. So practically it's like you have an expert in front of a junior. Obviously the expert is better at spotting certain disease than the junior. And that's actually like the power of AI. Mm-hmm. I hope the roadmap is clear. Let me know, Hisham, if you have any other questions. Also, please do note one thing. Oh yes, I do have a YouTube channel, but I'm not very active in it. Sorry about that. But you can check out my LinkedIn and GitHub. So usually when I work on projects, I put them there. So so I just wanted to add one thing, and then I will answer your questions, Zahia. Is actually I'm not sure about you, but for me, for example, I usually like things to be fast, and obviously, if results though if don't see results quickly, I get bored and all of that. But obviously, if you're going to make an impact anywhere, especially if you want to deploy an AI model that is really going to do something helpful and useful for someone or a certain society organization, you will need several iterations. It's true for any kind of software. So you develop the alpha version, then you develop the beta version, then you have the gamma version. And the thing about healthcare or AI in general is that you will be developing a lot of versions of it. You will be doing first research, you will be like trying to figure out how you can, kind of just how you can scope the problem, how you can define it, what are the things that you can use AI to help you with, and then what is success for you, what does it mean success for this kind of project, and things like that. So you will be doing lots of research. It will be maybe taking from 1 to 5 to 10 years to get your product done and working. So it will be taking a lot of your patience so that your models can be useful for healthcare providers and they can be secure. So Zahia, is AI secure in terms of our privacy and information? So that is a very hard question, simply because privacy depends on the user, the person that is going to use your data, and how they are using them. So, for example, I'm not sure, but in some countries, for example, you don't have the right to host those nationals' data. So, for example, let's say Morocco. So I'm from Morocco. So in Morocco, we don't have the right to host Moroccans' data anywhere apart from Morocco. So you can't host them in a cloud that is outside of Morocco. That's not possible for you. That is simply so they can protect our privacy and our data. And that is true also for Europe, for example. US also has its own regulations. So every big country usually had its own regulations. So if the people you're working with or the people that are developing this solution for you or for your hospital, they, align with the regulations that are set by your country or by a certain specific organization, then yes, I am sure your data is going to be secure because they follow the regulations. And usually, like, regulations are there to protect you as a citizen and as a person. And obviously, like, for example, if you develop models, so normally there is a way to back engineer them. Like anything, they can be hackable, but they in research these days they are coming up with ways to make it difficult for other people to back engineer these models. So there is current research happening to fight these kind of things. It's like, it's like cyber kind of attacks. Do you have some kind of other questions for me? Okay. Are there any title books that you can advise them in? Oh, yes. So there is what we call they're actually typical books that are advised by older experts in the field. So there is, for example, what we call the deep learning book from Ian Goodfellow and like Joshua Bengio and all of these, you know, amazing authors. So there is the deep learning book. There is also hands-on machine learning from Aurélien Géant. It's a great book as well to start with. If you want to go deeper, if you have a bit of understanding of mathematics and statistics, check out the deep learning book. If there are other books that are very good for the math side of these kind of models, it's a very difficult to read book, if especially if you don't have the basics and like the advanced knowledge of the math and probability. But it's good if you have these and if you want, like, to get a better understanding. It's like pattern recognition from Bishop Otter. And then apart from books, there are great, amazing, courses online. Like, for example, there is the deep learning course from deeplearning.ai. There is also the introduction to deep learning with PyTorch from Udacity. And there are, like, lots of amazing courses out there. There are also courses from MIT if you want to learn like the maths and like even the machine learning. They have lots of great courses. MIT has a lot of great courses. There are also lots of amazing courses from DeepMind, also from Google, like Intro to Machine Learning from Google, about TensorFlow also. So just like check them out. There are lots of amazing resources online. For the channel, try to check out MIT's YouTube channel. You're welcome, Zahir. Try to check out, MIT's YouTube channel. Also social accounts. Try to check out, like all the big universities like MIT, Carnegie Mellon. Um, there's also UCL. There is also New York, or I think let me just it's NY schools, New York schools, YouTube channels, and then courses. They have them available for free online. You can check them out, and like you can learn from them. And if you actually learn from them and understand what is happening and do all the coursewares they have, you will be lots better than all the courses out there. But if you find something difficult, try to check out blog posts. Well, thank you everyone for attending my session and for all the questions. Thanks a lot. It was nice to see you.